Hello everybody. My name is Juan. We will talk today about asthma and the environmental factors behind this disease. The objectives for this presentation are the following. First, understand the basic physiopathogenesis of asthma. Second, identify environmental factors associated with asthma and be able to identify different patterns of disease among the population and their relationship with environmental causes. Third, review what policies have been implemented in New York City to try to control these causes of asthma. And last, open the debate for new ideas about how to improve the quality of life in the city regarding this problem. So, what is asthma? Asthma is a disease that inflames and narrows the airways. Asthma causes recurring periods of wheezing, chest tightness, shortness of breath, and coughing, especially at night or early in the morning. Affects people of all ages, but it most often starts during childhood. In the United States, more than 25 million people are known to have asthma. About 7 million of these people are children. People who have asthma have inflamed airways. These are the tubes that carry air into the lungs. Usually, the inflammation also makes the airways swollen. The airways tend to react strongly to certain inhaled substances. When they react, less air flow into the lungs. Additionally, the cells in the airways might make more mucus than usual, and the swelling can make the airways even narrower. Please pause the video and look carefully at the graph. You will see the details of what happens into the airways when they react and give the patient the symptoms of asthma. The causes that originate asthma are multiple. Here, you can find different factors associated to the onset of the disease in the childhood. As you can see, there are different types of factors. For example, emotionals, genetics, and environmental, among others. Asthma is a chronic disease, and the most common chronic respiratory disease in children, but can be controlled reducing the number of episodes. One important step is taking the correct medication to control the inflammation of the airways. Another key element is to control those factors that play a role in the onset of an episode. The factors involved in the onset of an acute episode are called triggers, and they can be different in each patient. Can you recognize any of these triggers for asthma? There are a lot of triggers for asthma, and they can vary a lot from patient to patient. Please pause the video and look at the tables. Think about which ones can be prevented or reduced. As we see previously, environmental factors are involved in the early development of the disease, in conjunction with genetics, psychosocial and immunological factors. But environmental factors also play a key role as triggers in the occurrence of acute episodes in asthmatic patients. If we control the environmental exposures, we reduce the severity of the disease. Please pause the video and look at the map. Do you think, is asthma distribution equally distributed? The distribution is not equal. Asthma is more prevalent in urban areas with high concentration of poverty rates. The children from low socio-economical status families are the most affected. Being African American and Hispanic are also a risk factor. Please pause the video and look at these maps for a moment. You will notice that those areas with more air polluting facilities have higher hospitalization rates. The housing conditions are a big risk factor for asthma in New York City. The research available about asthma in New York City area found living in substandard housing appear to be strong neighborhood predictors of asthma hospitalizations. As we see previously, environmental factors are involved in the early development of the disease, in conjunction with genetics, psychosocial and immunological factors. The housing conditions are a big risk factor for asthma and exposure to indoor air pollutants are known triggers for asthma, such as rodent and cockroach allergens, mold and dust mites, air quality in the neighborhood, and the amount of air pollutants present in the outdoor are other great determinants. These interventions have been proved to be effective to reduce asthma in New York City. One is design strategies to improve the housing conditions, especially in low-income neighborhoods. For example, improved ventilation and general conditions. Another one is create campaigns to control indoor air pollutants that can be triggers. For example, cockroaches, particulate, smoke, and pets. Additionally, it is also important to enforce control about air quality in those areas more polluted. Last, it is necessary to improve the access to information about how to create clean spaces for people with asthma. Thanks for your attention. You can answer these questions to review the content of this presentation. Please pause the video and look carefully.